Muling nagbabala ang Department of Health sa posibleng pagsipa ng COVID-19 cases sa bansa pagdating ng Mayo, lalo kung magpapatuloy ang pagdami ng mga Pilipinong hindi sumusunod sa minimum public health standards. Alamin po natin ang palagay ng World Health Organization tungkol dyan. We have today Dr. Rehendra Yadav, the acting WHO representative to the Philippines. Good morning, Dr. Yadav.
Good morning and happy Easter to everyone.
Yes, now this year's Holy Week has just concluded, and with the election-related activities happening, how soon will we see its possible effects to our COVID numbers here in the Philippines?
So, as we expected, we saw people going in and out of Metro Manila to meet their family members, also on tourist destinations. So whether this social mixing and increased mobility during Easter will cause increase in cases or not depends on whether people wore masks and avoided crowds and poorly ventilated places, and also whether we are testing enough people. So now government is prioritizing testing among high risk groups, and we are not testing as much we were testing in the previous months. So number of cases should not, we should not rely on the number of cases to know whether we have too much COVID or not. Rather, we need to focus on increasing our vaccination. So in short, whether the numbers will increase or not, only time will tell. But also we should not focus too much on the numbers of cases, rather number of people who are vaccinated. That's more important.
Yes, Doc Yadav, what more can the Philippine government do to boost the vaccination drive in the country and convince more people to get vaccinated?
So the national government has already done a tremendous commendable job of ensuring that we have enough vaccines. Now it is up to the local government units and local chief executives to ensure that the vaccines reach the people who are still not vaccinated. So 50-60% of the people who had better access to vaccines, they could afford to travel, they could afford to miss their work time, they got vaccinated. So we have reached 60%, around 60% vaccination if we take total population as the denominator. But unfortunately, many barangays are still nowhere close to 70%. Actually, we need to go even much beyond 70% to create adequate herd immunity. So the local chief executives of the places where barangays have low coverage need to step up the reaching the unreached through last mile approach, which basically means using house to house vaccination and close to home vaccinations. So just if vaccinators sit at the vaccination sites, that's not adequate. We have to reach out to these people who may have more challenges of access, especially people who are elderly. They may not be able to travel even 20-30 minutes or may feel discouraged if they have to travel. So rather than waiting for them in vaccination sites, we have to reach out to them and get vaccinated. That's the best thing we can do.
Yes, Dr. Yadav, we have a question from Caroline Bonkin of CNN Philippines. How much testing is considered enough or needed?
So testing is less of a priority now. Of course, we have to test enough numbers so that we know whether we are facing any new variants of concern. So that has to continue. The genomic sequencing has to continue. But WHO recommends that we can prioritize high-risk groups for testing. So there is not a fixed number we can give. Ideally, we should test everyone who are at high risk, including frontline health workers and vulnerable groups like elderly people. But yes, if resources are there, then we can test more numbers like developed countries do. But rather now the focus should be on more vaccination. Our resources should go to getting more people vaccinated.
Dr. Yadav, do you agree that it's possible to reach 300,000 active cases by mid-May if our compliance to minimum health standards continues to decline?
Yes, I have seen those numbers. So we have to prove those numbers wrong. That's the challenge we face. Uh, if we have the low coverage that we have with vaccines in many barangays and many provinces, and if we relax our guards, if we relax our defenses, then yes, it's possible to get to those numbers because in Korea, which has South Korea, which has half the population of the Philippines, they have already touched 600,000 cases per day. That's huge. And there is no way of saying how that will affect the Philippines if we lower our guards. The good thing is that Filipinos are one of the best in terms of wearing a mask. So that needs to continue. There was some decline recently in the mask wearing. That should not happen. And we have to cover our people with vaccines. So these are the two best things we can do, masking and vaccination.
But Doc Yadav, do you agree on the recommendation to redefine the term fully vaccinated to include a booster dose? Would requiring an updated vaccination status help in convincing more Filipinos to get inoculated?
So WHO prefers to use the terms like primary series, which we know consisted of those two initial doses, and also the booster shots that follow. And we also prefer to use the term up to date with the recommended schedules. Fully vaccinated is a vague term because the definition may change with evolving evidence. How many boosters are required? Do we need to keep giving boosters every 6 months? We don't know that yet because this is a new pandemic and we are new. The COVID-19 is new for us. So it's better to use terms like up to date with the recommended schedules.
Dr. Yadav, question from the media, from Lay Alvis of GMA News. What are the WHO guidelines for the second booster dose?
So yes, some countries are using the second booster dose. Generally, we recommend that governments decide on the basis of availability of vaccine. The good thing is that the world does not have shortage of vaccines anymore, and definitely, if countries have enough vaccine, as is the case in Philippines, then high risk groups, especially the elderly, would definitely benefit from a second dose about 6 months after the second booster dose after the first booster. But it's up to countries. We know that the immunity because of vaccines go down with time, and that's why we encourage countries to have their own recommended schedules.
Dr. Yadav, other developments regarding the Omicron XE, how is this ongoing? The WHO regarding this recombinant variant, monitoring.
So Omicron XC, which is a hybrid of BA1 and BA2, we know that it's 10% more transmissible than BA2. However, so far it's the BA2 that continues to dominate globally, while Omicron XC has been found in a few countries, not yet in the Philippines. But irrespective of the variant, we have to follow the same things, protective measures that we have to do for any variant. So we have to keep vaccinating and masking.
Apart from the Omicron XC, Dr. Yadav, the WHO is also monitoring two more Omicron subvariants as reported in South Africa and Europe. What do we know about the BA.4 and the BA.5 so far? Should we be concerned about them as early as now?
So all Omicron variants are being monitored, and they are equally or a little more transmissible as the BA2. So the BA2 is the commonest, as I said, but BA4 and BA5 we are still monitoring. We don't know whether it will change the epidemiology or severity picture of the world yet. But as I mentioned, irrespective of what variant, Omicron is already so many times more infectious than the original variant of COVID-19. So we have to treat all these variants with equal precautions and equally intense actions.
But Dr. Yadav, how should the government react when and if the WHO named these recombinants as either variant of concern or variant of interest?
So reaction would mean that we have to be reactive, but rather than being reactive, the local government needs to continue to be proactive. The local chief executive should not wait for a new variant of interest or concern to arrive on the shores of the Philippines. Rather, we need to prevent huge waves that are likely to happen there in the coming months.
But Dr. Yadav, how important is it that the WHO and the rest of the international health community remain to be on top of the new strains and variants of COVID-19? When can we see the end of these mutations?
The only way to remain on top of the COVID-19 virus and prevent its creation and transmission is to achieve very high vaccination coverages, including booster doses. And we have to do that very quickly. The good news is that we have no vaccine shortage anywhere in the world. Bad news is that we are not reaching out to the unreached enough, and that will cause intense transmission, as is happening in many countries, and create more mutations.
Yes, Dr. Yadav, question from Jenna Balaor of GMA News. When will COVID become endemic? How will we know when COVID has become endemic?
So, endemic is not a great picture because many diseases are endemic, like tuberculosis is endemic and it kills millions of people. So, rather, we have to aim for sustained suppression of the COVID-19 pandemic. We have to have enough resources to manage any surges. We have to prevent deaths and suffering, but we have to avoid it becoming an endemic. Because as I mentioned, even malaria, for example, is endemic in many countries and it kills millions too, like tuberculosis.
Parting message or advice to the Filipinos in light of the upcoming national elections and all other possible events and celebration in the future? Go ahead, Dr. Yadav.
Yes, so my appeal to all Filipinos, and especially the local chief executives of places where there is a low vaccination coverage, my appeal is to continue with the three defenses we have. The first line of defense is to protect us against infection. That we can do through masking and ensuring good ventilation. Second line of defense is vaccination. Unfortunately, as I mentioned, many barangays have not reached the 70% coverage that WHO advises. We have to aim that all barangays have at least 70% vaccination coverage, but reach even beyond 80, 90, 100. And then the third line of defense is to protect against deaths. And for that, local chief executives and the national government need to ensure that the critical care services are as much as could be required if there is a huge surge in cases. If we do these three things, then we can prevent and even live with the COVID-19 virus at a subdued level. My appeal to the Filipinos themselves is to call up their local chief executives and request them to get more people vaccinated, because no one is safe unless everyone is safe. Many times we feel that we are vaccinated, we are safe. No, please do not believe that if you have received full vaccination, including boosters, you're 100% protected, because no vaccine is 100% protective. So everyone around you need to be protected to help you to be fully protected against the virus. So let's ensure that everybody gets vaccinated, and for that, if you have to call up the local chief executives, please do that and help them. Not just call them up, but also offer to help the local chief executives.
Dr. Yadav, thank you for joining us today. Dr. Rehendra Yadav, the acting WHO representative to the Philippines. Thank you, Doc.